So today we're here to talk about what is a dental assistant. A dental assistant is a field in the healthcare system that deals with assisting the doctor or hygienist. There are two types of assistants. We have the front office that deals with administration duties, and we have the back office that deals with clinical procedures. We as dental assistants are the first point of contact for patients, whether it's taking appointments or seating them in the chair to take the vitals or x-rays. As a dental assistant, we do have to pay close attention to detail, follow the rules and regs as stated by each state. As an assistant, we do have to show empathy and compassion. There are a lot of patients who are afraid to come to dentists, and we're the people who have to make them comfortable and be able to come for a second appointment. So we have roles of a dental assistant. In the dental office, we have assist the dentist or hygienist, or both, take vitals, take x-rays, have lab cases sent to labs, help with the front office duties depending on how busy the office is, or vice versa. If you work in the front, you'll help with the back as well. Teach the patient good oral hygiene. We also deal with sterilization, so we do have to keep our instruments sterilized for the next procedures. And we do have to follow protocols issued by OSHA, CDC, and OSAP. Somebody a good dental assistant. First one we have is compassion and empathy. Like I mentioned earlier in the video, we have patients that have not been to the dentist in years, and they finally come in because they want to give it a try again, or they come in because they have a toothache, and sometimes they have no choice but to come in because there's a chipped tooth, cracked tooth, hole in the tooth, whatever it is. And the goal to me is to make sure they come back for a second appointment, third appointment, and become a regular patient, whether it's at your office or any other office. So that's the goal of trying to make them comfortable. And we have the second one, I think, is detail oriented. You want to pay close attention to every detail that goes on in the office. You want to make sure you're listening to whatever the doctor is saying. You want to make sure you have the right tooth numbers. You want to make sure you have the right procedures, the right codes, all of that stuff. You want to just be very careful because we're dealing with patients and you don't want to make any mistakes. Next one we have is organization. So you want to make sure you keep the office organized. Make sure you know where all your supplies are. Make sure you know where your instruments are. You don't want to have to be looking for stuff in the middle of a procedure. You want to make sure when you set up for an appointment, you have everything placed on the tray that needs to be placed on the tray. That way in the middle of a procedure, you won't have to be looking for anything. Another one is you have to be a multitasker. Sometimes you'll have a patient taking x-rays while the patient is waiting for the doctor. You go and you do something else, or you want to keep the office going. Like say if we're waiting for the doctor for one room, you'll want to go seat another patient, take their vitals while you wait for the doctor. There's many things that you can do instead of just sitting waiting for the doctor. You can just start something else instead of just sitting there. We have dexterity as well. You'll be using your hands a lot, both hands. Sometimes when I first started, I was right-handed. I couldn't use my right hand, but by the time I was 3 or 4 years in, I was basically using my left and my right hand. So and it comes with practice. As you practice more, you become more efficient with dexterity.